Color blindness, also known as color vision deficiency, is the decreased ability to see color or differences in color. Color blindness can make some educational activities difficult. Buying fruit, picking clothing, and reading traffic lights can be more challenging, for example. Problems, however, are generally minor and most people adapt. People with total color blindness, however, may also have decreased visual acuity and be uncomfortable in bright environments. The most common cause of color blindness is an inherited fault in the development of one or more of the three sets of color sensing cones in the eye. Males are more likely to be color blind than females, as the genes responsible for the most common forms of color blindness are on the X chromosome. As females have two X chromosomes, a defect in one is typically compensated for by the other, while males only have one X chromosome. Color blindness can also result from physical or chemical damage to the eye, optic nerve, or parts of the brain. Diagnosis is typically with the Ishihara color test, however a number of other testing methods also exist. There is no cure for color blindness. Diagnosis may allow a person's teacher to change their method of teaching to accommodate the decreased ability to recognize colors. Special lenses may help people with red-green color blindness when under bright conditions. There are also mobile apps that can help people identify colors. Red-green color blindness is the most common form, followed by blue-yellow color blindness and total color blindness. Red-green color blindness affects up to 8% of males and 0.5% of females of Northern European descent. The ability to see color also decreases in old age. Being colorblind may make people ineligible for certain jobs in certain countries. This may include pilot, train driver, and armed forces. The effect of color blindness on artistic ability, however, is controversial. The ability to draw appears to be unchanged and a number of famous artists are believed to have been colorblind. Signs and symptoms. In almost all cases, colorblind people retain blue-yellow discrimination, and most colorblind individuals are anomalous trichromat rather than complete dichromat. In practice, this means that they often retain a limited discrimination along the red-green axis of color space, although their ability to separate colors in this dimension is reduced. Color blindness very rarely refers to complete monochromatism. Dichromat often confuse red and green items. For example, they may find it difficult to distinguish a Braeburn apple from a Granny Smith or red from green of traffic lights without other clues, for example, shape or position. Dichromat tend to learn to use texture and shape clues and so may be able to penetrate camouflage that has been designed to deceive individuals with normal color vision. Colors of traffic lights are confusing to some dichromat as there is insufficient apparent difference between the red/amber traffic lights and sodium street lamps. Also, the green can be confused with a grubby white lamp. This is a risk on high-speed undulating roads where angular cues cannot be used. British Rail color lamp signals use more easily identifiable colors. The red is blood red, the amber is yellow and the green is a bluish color. Most British road traffic lights are mounted vertically on a black rectangle with a white border, forming a sighting board, and so dichromat can more easily look for the position of the light within the rectangle top, middle, or bottom. In the eastern provinces of Canada, horizontally mounted traffic lights are generally differentiated by shape to facilitate identification for those with color blindness. In the United States, this is not done by shape but by position, as the red light is always on the left if the light is horizontal, or on top if the light is vertical. However, a single flashing light, red indicating cars must stop, yellow for caution/yield, is indistinguishable, but these are rare. Causes. Color vision deficiencies can be classified as acquired or inherited. Acquired, diseases, drugs, e.g., plaquenil and chemicals may cause color blindness. Inherited, there are three types of inherited or congenital color vision deficiencies: monochromacy, dichromachy, and anomalous trichromacy. Monochromacy, also known as total color blindness, is the lack of ability to distinguish colors, and thus the person views everything as if it were on a black and white television, caused by cone defect or absence. Monochromacy occurs when two or all three of the cone pigments are missing and color and lightness vision is reduced to one dimension. Rod monochromacy, achromatopsia, is an exceedingly rare, non-progressive inability to distinguish any colors as a result of absent or non-functioning retinal cones. It is associated with light sensitivity, photophobia, involuntary eye oscillations, nystagmus, and poor vision. Cone monochromacy is a rare total color blindness that is accompanied by relatively normal vision, electroretinogram, and electroculogram. Cone monochromacy can also be a result of having more than one type of dichromatic color blindness. People who have, for instance, both protanopia and tritanopia are considered to have cone monochromacy. Since cone monochromacy is the lack of / damage of more than one cone in retinal environment, having two types of dichromakey would be an equivalent. Dichromakey is a moderately severe color vision defect in which one of the three basic color mechanisms is absent or not functioning. It is hereditary and, in the case of protanopia or deuteranopia, sex-linked, affecting predominantly males. Dichromakey occurs when one of the cone pigments is missing and color is reduced to two dimensions. Dichromakey conditions are labeled based on whether the first, Greek, prot, referring to the red photoreceptors, second, deuter, the green, or third, trit, the blue, photoreceptors are affected. Protanopia is a severe type of color vision deficiency caused by the complete absence of red retinal photoreceptors. Protons have difficulties distinguishing between blue and green colors and also between red and green colors. It is a form of dichromatism in which the subject can only perceive light wavelengths from 400 to 650 nm, instead of the usual 700 nm. Pure reds cannot be seen, instead appearing black. Purple colors cannot be distinguished from blues, more orange-tinted reds may appear as very dim yellows, and all orange yellow-green shades of too long a wavelength to stimulate the blue receptors appear as a similar yellow hue. It is hereditary, sex-linked, and present in 1% of males. Deuteranopia is a type of color vision deficiency where the green photoreceptors are absent. It affects hue discrimination in the same way as protanopia, but without the dimming effect. Like protanopia, it is hereditary, sex-linked, and found in about 1% of the male population. Tritanopia is a very rare color vision disturbance in which there are only two cone pigments present and a total absence of blue retinal receptors. Blues appear greenish, yellows and oranges appear pinkish, and purple colors appear deep red. It is related to chromosome 7. Unlike protanopia and deuteranopia, tritanopia and tritanomaly are not sex-linked traits and can be acquired rather than inherited and can be reversed in some cases. Anomalous trichromakey is a common type of inherited color vision deficiency, occurring when one of the three cone pigments is altered in its spectral sensitivity. Protanomaly is a mild color vision defect in which an altered spectral sensitivity of red retinal receptors, closer to green receptor response, results in poor red-green hue discrimination. It is hereditary, sex-linked, and present in 1% of males. The difference with protanopia is that in this case the L cone is present but malfunctioning, whereas in the earlier the L cone is completely missing. Deuteranomaly, caused by a similar shift in the green retinal receptors, is by far the most common type of color vision deficiency, mildly affecting red-green hue discrimination in 5% of European males. It is hereditary and sex-linked. The difference with deuteranopia is that in this case the green-sensitive cones are not missing but malfunctioning. Tritanomaly is a rare, hereditary color vision deficiency affecting blue-green and yellow-red/pink hue discrimination. It is related to chromosome 7. The difference is that the S cone is malfunctioning but not missing. Genetics. Color blindness is typically inherited. It is most commonly inherited from mutations on the X chromosome, but the mapping of the human genome has shown there are many causative mutations. Mutations capable of causing color blindness originate from at least 19 different chromosomes and 56 different genes, as shown online at the online Mendelian Inheritance in Man, OMIM. Two of the most common inherited forms of color blindness are protanomaly, and, more rarely, protanopia, the two together often known as protons, and deuteranomaly, or, more rarely, deuteranopia, the two together often referred to as deutons. Both protons and deutons, of which the deutons are by far the most common, are known as red-green colorblind, which is present in about 8% of human males and 0.6% of females of Northern European ancestry. Some of the inherited diseases known to cause color blindness are cone dystrophy, cone rod dystrophy, achromatopsia, aka rod monochromatism, stationary cone dystrophy or cone dysfunction syndrome, blue cone monochromatism, aka blue cone monochromacy or X-linked achromatopsia, Leber's congenital amaurosis, retinitis pigmentosa, initially affects rods but can later progress to cones and therefore color blindness. Inherited color blindness can be congenital, from birth, or it can commence in childhood or adulthood. Depending on the mutation, it can be stationary, that is, remain the same throughout a person's lifetime, or progressive. As progressive phenotypes involve deterioration of the retina and other parts of the eye, certain forms of color blindness can progress to legal blindness, i.e., an acuity of 6/60, 20/200, or worse, and often leave a person with complete blindness. Color blindness always pertains to the cone photoreceptors in retinas, as the cones are capable of detecting the color frequencies of light. About 8% of males, and 0.6% of females, are red-green color blind in some way or another, whether it is one color, a color combination, or another mutation. The reason males are at a greater risk of inheriting an X-linked mutation is that males only have one X chromosome, XY, with the Y chromosome carrying altogether different genes than the X chromosome, and females have two, XX. If a woman inherits a normal X chromosome in addition to the one that carries the mutation, she will not display the mutation. Men do not have a second X chromosome to override the chromosome that carries the mutation. If 8% of variants of a given gene are defective, the probability of a single copy being defective is 8%, but the probability that two copies are both defective is 0.08 times 0.08 equals 0.0064, or just 0.64%. Other causes. Other causes of color blindness include brain or retinal damage caused by shaken baby syndrome, accidents, and other trauma which produce swelling of the brain in the occipital lobe, and damage to the retina caused by exposure to ultraviolet light, 10-300 nm. Damage often presents itself later on in life. Color blindness may also present itself in the spectrum of degenerative diseases of the eye, such as age-related macular degeneration, and as part of the retinal damage caused by diabetes. Another factor that may affect color blindness includes a deficiency in vitamin A. Some subtle forms of color blindness may be associated with chronic solvent-induced encephalopathy, CSE, caused by long-time exposure to solvent vapors. Red-green color blindness can be caused by ethambutol, a drug used in the treatment of tuberculosis. Types. Based on clinical appearance, color blindness may be described as total or partial. Total color blindness is much less common than partial color blindness. There are two major types of color blindness: those who have difficulty distinguishing between red and green, and who have difficulty distinguishing between blue and yellow. Immunofluorescent imaging is a way to determine red-green color coding. Conventional color coding is difficult for individuals with red-green color blindness, protanopia or deuteranopia, to discriminate. Replacing red with magenta or green with turquoise improves visibility for such individuals. The different kinds of inherited color blindness result from partial or complete loss of function of one or more of the different cone systems. When one cone system is compromised, Chromakey results. The most frequent forms of human color blindness result from problems with either the middle or long wavelength sensitive cone systems, and involve difficulties in discriminating reds, yellows, and greens from one another. They are collectively referred to as red-green color blindness, though the term is an oversimplification and is somewhat misleading. Other forms of color blindness are much more rare. They include problems in discriminating blues from greens and yellows from reds/pinks, and the rarest forms of all, complete color blindness or monochromacy, where one cannot distinguish any color from gray, as in a black and white movie or photograph. Protanopes, deuteranopes, and tritanopes are dichromat, that is, they can match any color they see with some mixture of just two primary colors, whereas normally humans are trichromat and require three primary colors. These individuals normally know they have a color vision problem and it can affect their lives on a daily basis. 2% of the male population exhibit severe difficulties distinguishing between red, orange, yellow, and green. A certain pair of colors, that seem very different to a normal viewer, appear to be the same color, or different shades of same color, for such a dichromat. The terms protanopia, deuteranopia, and tritanopia come from Greek and literally mean inability to see, anopia, with the first, prot, second, deuter, or third, trit, respectively. Anomalous trichromacy is the least serious type of color deficiency. People with prot anomaly, deuter anomaly, or trit anomaly are trichromat, but the color matches they make differ from the normal. They are called anomalous trichromat. In order to match a given spectral yellow light, prot anomalous observers need more red light in a red/green mixture than a normal observer, and deuter anomalous observers need more green. From a practical standpoint though, many prot anomalous and deuter anomalous people have very little difficulty carrying out tasks that require normal color vision. Some may not even be aware that their color perception is in any way different from normal. Prot anomaly and deuter anomaly can be diagnosed using an instrument called an anomaloscope, which mixes spectral red and green lights in variable proportions, for comparison with a fixed spectral yellow. If this is done in front of a large audience of males, as the proportion of red is increased from a low value, first a small proportion of the audience will declare a match, while most will see the mixed light as greenish. These are the deuter anomalous observers. Next, as more red is added, the majority will say that a match has been achieved. Finally, as yet more red is added, the remaining, prot anomalous, observers will declare a match at a point where normal observers will see the mixed light as definitely reddish. Red-green color blindness. Protanopia, deuteranopia, prot anomaly, and deuter anomaly are commonly inherited forms of red-green color blindness which affect a substantial portion of the human population. Those affected have difficulty with discriminating red and green hues due to the absence or mutation of the red or green retinal photoreceptors. It is sex-linked. Genetic red-green color blindness affects males much more often than females, because the genes for the red and green color receptors are located on the X chromosome, of which males have only one and females have two. Females, 46, XX, are red-green color blind only if both their X chromosomes are defective with a similar deficiency, whereas males, 46, XY, are color blind if their single X chromosome is defective. The gene for red-green color blindness is transmitted from a color-blind male to all his daughters who are heterozygote carriers and are usually unaffected. In turn, a carrier woman has a 50% chance of passing on a mutated X chromosome region to each of her male offspring. The sons of an affected male will not inherit the trait from him, since they receive his Y chromosome and not his defective X chromosome. Should an affected male have children with a carrier or colorblind woman, their daughters may be colorblind by inheriting an affected X chromosome from each parent. Because one X chromosome is inactivated at random in each cell during a woman's development, deuter anomalous heterozygotes, i.e. female carriers of deuter anomaly, are potentially tetrachromats, because they will have the normal long wave, red, receptors, the normal medium wave, green, receptors, the abnormal medium wave, deuter anomalous, receptors and the normal autosomal short wave, blue, receptors in their retinas. The same applies to the carriers of prot anomaly, who have two types of short wave receptors, normal medium wave receptors, and normal autosomal short wave receptors in their retinas. If, by chance, a woman is heterozygous for both prot anomaly and deuter anomaly, she could be pentachromatic. This situation could arise if, for instance, she inherited the X chromosome with the abnormal long wave gene, but normal medium wave gene, from her mother who is a carrier of prot anomaly, and her other X chromosome from a deuter anomalous father. Such a woman would have a normal and an abnormal long wave receptor, a normal and abnormal medium wave receptor, and a normal autosomal short wave receptor. 5 different types of color receptors in all. The degree to which women who are carriers of either protonomaly or deuteranomaly are demonstrably tetrachromatic and require a mixture of 4 spectral lights to match an arbitrary light is very variable. In many cases it is almost unnoticeable, but in a minority the tetrachromacy is very pronounced. However, Jameson et al. Have shown that with appropriate and sufficiently sensitive equipment all female carriers of red-green color blindness, i.e. heterozygous protonomaly, or heterozygous deuteranomaly, are tetrachromats to a greater or lesser extent. Since deuteranomaly is by far the most common form of red-green blindness among men of northwestern European descent, with an incidence of 8%, then the carrier frequency, and of potential deuteranomalous tetrachromacy, among the females of that genetic stock is 14.7%, equals x2. Protanopia, 1% of males lacking the red cones for long wavelength sensitive retinal cones. Those with this condition are unable to distinguish between colors in the green-yellow-red section of the spectrum. They have a neutral point at a cyan-like wavelength around 492 nm, see spectral color for comparison, that is, they cannot discriminate light of this wavelength from white. For a protanope, the brightness of red, orange, and yellow are much reduced compared to normal. This dimming can be so pronounced that reds may be confused with black or dark gray, and red traffic lights may appear to be extinguished. They may learn to distinguish reds from yellows primarily on the basis of their apparent brightness or lightness, not on any perceptible hue difference. Violet, lavender, and purple are indistinguishable from various shades of blue because their reddish components are so dimmed as to be invisible. For example, pink flowers, reflecting both red light and blue light, may appear just blue to the protanope. A very few people have been found who have one normal eye and one protanopic eye. These unilateral dichromat report that with only their protanopic eye open, they see wavelengths shorter than neutral point as blue and those longer than it as yellow. This is a rare form of color blindness. Deuteranopia, 1% of males lacking the green cones for medium wavelength cones. Those affected are again unable to distinguish between colors in the green-yellow-red section of the spectrum. Their neutral point is at a slightly longer wavelength, 498 nm, a more greenish hue of cyan. A deuteranope suffers the same hue discrimination problems as protanopes, but without the abnormal dimming. Purple colors are not perceived as something opposite to spectral colors, all these appear similarly. This form of color blindness is also known as Daltonism after John Dalton. His diagnosis was confirmed as deuteranopia in 1995, some 150 years after his death, by DNA analysis of his preserved eyeball. Equivalent terms for Daltonism in Romanic languages such as Daltonismo, Spanish, Portuguese, and Italian, Daltonismo, French, Daltonism, Romanian, are still used to describe color blindness in a broad sense or deuteranopia in a more restricted sense. Deuteranopic unilateral dichromat report that with only their deuteranopic eye open, they see wavelengths shorter than neutral point as blue and longer than it as yellow. Protonomaly, 1% of males, 0.01% of females having a mutated form of the long wavelength, red, pigment, whose peak sensitivity is at a shorter wavelength than in the normal retina. Protonomalous individuals are less sensitive to red light than normal. This means that they are less able to discriminate colors, and they do not see mixed lights as having the same colors as normal observers. They also suffer from a darkening of the red end of the spectrum. This causes reds to reduce in intensity to the point where they can be mistaken for black. Protonomaly is a fairly rare form of color blindness, making up about 1% of the male population. Both protonomaly and deuteranomaly are carried on the X chromosome. Deuteranomaly, most common 6% of males, 0.4% of females. These individuals have a mutated form of the medium wavelength, green, pigment. The medium wavelength pigment is shifted towards the red end of the spectrum, resulting in a reduction in sensitivity to the green area of the spectrum. Unlike protonomaly, the intensity of colors is unchanged. The deuteranomalous person is considered green weak. For example, in the evening, dark green cars appear to be black to deuteranomalous people. Similar to the protanomates, deuteranomates are poor at discriminating small differences in hues in the red, orange, yellow, green region of the spectrum. They make errors in the naming of hues in this region because the hues appear somewhat shifted towards green. One very important difference between deuteranomalous individuals and protanomalous individuals is deuteranomalous individuals do not have the loss of brightness problem. Blue-yellow color blindness. Those with tritanopia and tritanomaly have difficulty discriminating between bluish and greenish hues, as well as yellowish and reddish hues. Color blindness involving the inactivation of the short wavelength sensitive cone system, whose absorption spectrum peaks in the bluish-violet, is called tritanopia or, loosely, blue-yellow color blindness. The tritanope's neutral point occurs near a yellowish 570 nm, green is perceived at shorter wavelengths and red at longer wavelengths. Mutation of the short wavelength sensitive cones is called tritanomaly. Tritanopia is equally distributed among males and females. Jeremy H. Nathans, with the Howard Hughes Medical Institute, demonstrated that the gene coding for the blue receptor lies on chromosome 7, which is shared equally by males and females. Therefore, it is not sex-linked. This gene does not have any neighbor whose DNA sequence is similar. Blue color blindness is caused by a simple mutation in this gene. Tritanopia, less than 1% of males and females lacking the short wavelength cones, those affected see short wavelength colors, blue, indigo and a spectral violet, greenish and drastically dimmed, some of these colors even as black. Yellow is indistinguishable from pink, and purple colors are perceived as various shades of red. This form of color blindness is not sex-linked. Tritanomaly, equally rare for males and females having a mutated form of the short wavelength, blue, pigment. The short wavelength pigment is shifted towards the green area of the spectrum. This is the rarest form of anomalous Chromakey color blindness. Unlike the other anomalous Chromakey color deficiencies, the mutation for this color blindness is carried on chromosome 7. Therefore, it is equally prevalent in both male and female populations. The OMIM gene code for this mutation is 304,000. Color blindness, partial tritanomaly. Total color blindness. Total color blindness is defined as the inability to see color. Although the term may refer to acquired disorders such as cerebral achromatopsia, also known as color agnosia, it typically refers to congenital color vision disorders, i.e. more frequently rod monochromacy and less frequently cone monochromacy. In cerebral achromatopsia, a person cannot perceive colors even though the eyes are capable of distinguishing them. Some sources do not consider these to be true color blindness, because the failure is of perception, not of vision. They are forms of visual agnosia. Monochromacy is the condition of possessing only a single channel for conveying information about color. Monochromat possess a complete inability to distinguish any colors and perceive only variations in brightness. It occurs in two primary forms. Rod monochromacy, frequently called achromatopsia, where the retina contains no cone cells, so that in addition to the absence of color discrimination, vision in lights of normal intensity is difficult. While normally rare, achromatopsia is very common on the island of Pinjalap, a part of the Pohnpei state, Federated States of Micronesia, where it is called Maskan. About 10% of the population there has it, and 30% are unaffected carriers. The island was devastated by a storm in the 18th century, an example of a genetic bottleneck, and one of the few male survivors carried a gene for achromatopsia. The population grew to several thousand before foreign troops introduced diseases to the island in the 1940s. Cone monochromacy is the condition of having both rods and cones, but only a single kind of cone. A cone monochromat can have good pattern vision at normal daylight levels, but will not be able to distinguish hues. Blue cone monochromacy, X chromosome, is caused by lack of functionality of L and M cones, red and green. It is encoded at the same place as red-green color blindness on the X chromosome. Peak spectral sensitivities are in the blue region of the visible spectrum, near 440 nm. People with this condition generally show nystagmus, jiggling eyes, photophobia, light sensitivity, reduced visual acuity, and myopia, nearsightedness. Visual acuity usually falls to the 20/50 to 20/400 range. Mechanism. The typical human retina contains two kinds of light cells, the rod cells, active in low light, and the cone cells, active in normal daylight. Normally, there are three kinds of cone cells, each containing a different pigment, which are activated when the pigments absorb light. The spectral sensitivities of the cones differ. One is most sensitive to short wavelengths, one to medium wavelengths, and the third to medium to long wavelengths within the visible spectrum, with their peak sensitivities in the blue, green, and yellow-green regions of the spectrum, respectively. The absorption spectra of the three systems overlap, and combine to cover the visible spectrum. These receptors are known as short, S, medium, M, and long, L, wavelength cones, but are also often referred to as blue, green, and red cones, although this terminology is inaccurate. The receptors are each responsive to a wide range of wavelengths. For example, the long wavelength red receptor has its peak sensitivity in the yellow-green, some way from the red end, longest wavelength, of the visible spectrum. The sensitivity of normal color vision actually depends on the overlap between the absorption ranges of the three systems. Different colors are recognized when the different types of cone are stimulated to different degrees. Red light, for example, stimulates the long wavelength cones much more than either of the others, and reducing the wavelength causes the other two cone systems to be increasingly stimulated, causing a gradual change in hue. Many of the genes involved in color vision are on the X chromosome, making color blindness much more common in males than in females because males only have one X chromosome, while females have two. Because this is an X-linked trait, an estimated 2–3% of women have a fourth color cone and can be considered tetrachromats. One such woman has been reported to be a true or functional tetrachromat, as she can discriminate colors most other people can't. Diagnosis. The Ishihara color test, which consists of a series of pictures of colored spots, is the test most often used to diagnose red-green color deficiencies. A figure, usually one or more Arabic D.
Please subscribe and thanks for watching.